with sitting and forward bending is a common problem that a lot of people have. Today we're going to be going over 3 basic exercises as well as 2 things that you probably shouldn't do when you have this sort of pain. So back pain with sitting is a very common complaint that we see here in the clinic. As always, if you are experiencing moderate intensity pain or pain that is worsening over time, then please do go and see your medical practitioner. Today we're just going to be going over a few basic exercises that may help reduce the intensity of these symptoms. So we've got Hallie here who is experiencing a little bit of pain with sitting. The first thing that we want to do is establish a direction and see if moving in the opposite direction to the direction of symptoms helps with the symptoms. So she's reporting pain with sitting. Let's get you moving in the opposite direction. So sitting is what we call a flexion pattern when the spine is sort of curved in this direction. So we're going to get Hallie moving in the opposite direction. So I'm going to get you to stand up and perhaps if we can get you to face side on, so you side on towards the camera, place your hands on your hips for me. And from there, I'm just going to get you to arch backwards. Good. And then come back to the starting position. Just do that a few times for me, please. Now, some instances of back pain will be painful with moving in both directions. So if this is the case, this is probably not an ideal exercise. However, if forward bending and sitting is painful, but back bending is not, then repeated back bending can often help reduce the symptoms. The next thing that can be useful is some basic pelvic tilts. So if we can't get up from the chair, we can basically perform a slight extension, a slight reversal of the painful direction just by tilting the pelvis forward. So Hallie, if you imagine that your pelvis is like a bucket of water, we're going to get you tilting that bucket forward, so you're tipping some of the water out of the front. Now you don't have to go too far. This is not a range of motion exercise, just some gentle movement forwards and then back again. And if you imagine that you're doing this movement and almost sort of lubricating the spine, this can be really useful if you're someone who experiences a little bit of increase in their pain when they go to stand up after prolonged sitting. Then doing this before you go to stand up can often reduce those symptoms. Another useful exercise is a cat-camel or a cat-cow exercise where you're going from a position of flexion to a position of extension. When you're doing this though, if you have pain with sitting or forward bending, you only want to go to there. So we don't want to go into a position where we're fully flexed. We're just doing sort of the extension phase in that movement. So from there to about there, and just going through a pain-free range. We don't want to flex the spine to the point where we're reproducing the symptoms. Some things that are probably not the best to do, especially if you're in the acute stage of the injury, if you've got forward bending related pain, sometimes it might feel intuitive to push into that pain, and later on in the rehabilitation process we do want to restore the previously painful range of motion. But early on, doing a forward bending movement, if it is a little bit sore and you feel like you want to stretch into it, it's probably not the best thing to do. So actually avoid moving into the painful direction. And the other thing that's usually not the best to do in most cases of acute lower back pain is a rotation stretch. Now, sometimes if you have if you have pain with twisting and rotation, we can sometimes move in the opposite direction. But as a general rule, a lot of spines, especially in acute stages of painful conditions, are sensitive to rotation. So a movement such as bringing the leg up and across the body like this, again, you might get that sort of sensation of pushing on a sore tooth. It sort of feels nice to reproduce the pain, but it's something that may actually flare things up. So as we said off the top, this isn't to be considered medical advice. If you do have moderate symptoms or symptoms that are worsening or progressing over time, please do see your physiotherapist or doctor. If it's just some mild soreness and you're looking for some ways to try and relieve the soreness, give these exercises a go. And as we said, if you're just experiencing some mild soreness, give these exercises a go and see if they help. And also try and avoid some of those stretches that whilst they may feel good at the time, may actually be provoking the symptoms. As always, thanks very much for watching, and please don't forget to like and subscribe for more fitness training and rehab information. We'll see you on the next episode.